Before going to the topic, we have to know what is the normal count of platelet in an adult person. The normal count of platelet is 1,50,000 per cubic millimeter of blood to 4 lakh per cubic millimeter of blood. Now, in most of the case of a normal pregnancy, the patient maintains a good platelet count in her blood. Only in 7 to 10% of case of pregnancy, patient may develop a reduced count of platelet, that is called thrombocytopenia. When the platelet count is below 1,50,000 per cubic millimeter of blood, we call it a thrombocytopenia. Now, what are the causes that in these 7 to 10% of pregnant lady they develop thrombocytopenia? It depends upon the time when the patient is developing the thrombocytopenia. Most commonly they develop thrombocytopenia at the third trimester of pregnancy. That means in a very advanced stage of pregnancy, and most common causes are preeclampsia and eclampsia. What is preeclampsia? In advanced pregnancy, sometimes these patients they develop increased blood pressure. There are some signs of water retention in the body, that is bipedal edema, and proteinuria, that is called preeclampsia. And associated with these three symptoms, patients sometimes may develop a convulsion, that is called eclampsia. In these cases, patient may develop a low platelet count, that is called HELLP syndrome. HELLP means hemolysis, elevated liver enzymes, and low platelet count. So, if a patient develop this type of symptoms in an advanced stage of pregnancy, we have to do some simple tests. What are those tests? We can do a simple complete blood count, from where we can see whether the patient is developing any low RBC count and as well as any low platelet count. If we do a peripheral blood smear study, we can get some schistocytes, that means fragmented RBC, denotes that there is an ongoing hemolysis. And if we do some biochemical tests like liver enzymes, SGPT, SGOT, that will be raised. So if we get these features, these schistocytes with low hemoglobin, low platelet count, elevated liver enzymes, we can say that this patient is developing a HELLP syndrome. Then the gynecologist will manage the case accordingly. Now, sometimes a normally pregnant lady, they develop low platelet count at the second trimester of pregnancy, generally after 12 weeks of pregnancy. In these cases, most of the time the platelet count which is reduced is mildly reduced. Generally that is just below 1 lakh, but not below 50,000. Though they are very rare to develop this low platelet count in second trimester of pregnancy, but sometimes these patients may develop that is called gestational thrombocytopenia, but that is very rare. First we have to search for any secondary cause of this low platelet count, like immune thrombocytopenic purpura, or suppose patient is taking any drug which may cause a low platelet count, we have to search for that. If we do not get any such conditions which may lead to low platelet count, then we only call it may be a case of gestational thrombocytopenia. But there is no definite investigations to denote it as a sure form of gestational thrombocytopenia. Only we can diagnose the case by diagnosis of exclusion. That means we have to exclude other possible causes of thrombocytopenia, and if we do not get any definite cause, then only we can say it as a pure gestational thrombocytopenia that generally develop at second trimester of pregnancy. Sometimes to differentiate between a simple gestational thrombocytopenia from a immune thrombocytopenic purpura, these patients are given immunoglobulins. If the platelet count increases, then we can call it a immune thrombocytopenic purpura, but if the platelet count does not get corrected, then we call it a gestational thrombocytopenia, but that is very rare. A very few percentage of patients they develop at the second trimester of pregnancy. So what is my conclusion? Most of the time thrombocytopenia is developed at third trimester of pregnancy, that is at a very advanced stage of pregnancy, and that is mostly due to this HELLP syndrome. Very rarely a patient may develop thrombocytopenia at second trimester of pregnancy onward. That may be due to immune thrombocytopenic purpura or any other secondary cause, or a very rare cases that is a pure form of gestational thrombocytopenia. Now, if there is thrombocytopenia, should we be very cautious? If it is due to HELLP syndrome, that yes, we have to treat it aggressively because the outcome may be very grave if we cannot manage that at very initial stage of development. But if it is due to pure gestational thrombocytopenia, we can wait and watch. If there is no signs of bleeding, generally these patients are not given any definitive treatment. But if they develop any signs of bleeding, then only aggressive treatment is given. Okay, thank you.